بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وآله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. My topic today is about introduction to mediastinum, and I will discuss in this short talk about the mediastinal divisions, anterior, posterior, and middle, and its contents. The mediastinum comprises the region extended from the thoracic inlet to diaphragm and interposed between the two pleural cavities. There is no clear anatomic demarcation between the three mediastinal compartments. In any method used to divide the mediastinum, the division is theoretic rather than physical, and the disease can spread from one compartment to another, and some diseases don't occur exclusively in any compartment. However, for ease of the classification and practically I adopt a modified anatomic method dividing the mediastinum into anterior, middle, and posterior with no separate superior mediastinum. Here we see this lateral X-ray according to the Filson. The anterior mediastinal here, and the middle mediastinal here, and the posterior mediastinal here. This is the A line, and it is extended from the diaphragm to the thoracic inlet along the back of the heart and anterior to the trachea, separating the anterior mediastinum from the middle mediastinum. And this B line, it is extended about from the diaphragm to the thoracic inlet about 1 centimeter behind the anterior margin of the vertebral body and separate the middle mediastinum from the posterior mediastinum. Here, the anterior mediastinum is bounded anteriorly by sternum and posteriorly by the pericardium here and the brachiocephalic vessels, and superiorly by the thoracic inlet and inferiorly by the diaphragm. It contains the thymus, lymph node, adipose tissue, and internal mammary vessels. So this is the anterior mediastinum, contains thymus, lymph nodes, adipose tissue, internal mammary vessels. Here we see the middle mediastinum is bounded anteriorly by the pericardium and posteriorly by pericardium and posterior tracheal wall, superiorly by thoracic inlet here and inferiorly by the diaphragm. It contains the heart, pericardium, ascending aorta, transverse aorta, superior vena cava, and inferior vena cava here, and the brachiocephalic vessels and pulmonary vessels, and also the trachea and lymph node and the phrenic and vagus nerves, and also left recurrent laryngeal nerve. Here we see the posterior mediastinum. It is bounded anteriorly by the posterior trachea and the pericardium, and inferiorly by the diaphragm and posteriorly by the vertebral column, and it is superiorly by thoracic inlet. As we said previously, the true anatomic boundary is the vertebral column. With respect to mediastinal disease, masses in the paraspinal region are usually included in the posterior mediastinum, and the contents of the posterior mediastinum include the esophagus, descending aorta, azygos and hemiazygous vein, thoracic duct, vagus and splanchnic nerves, lymph node and fat. Here we see the mediastinal compartment classification according to the Japanese Association for Research on the Thymus, and they include three compartments: anterior, middle, and posterior mediastinum. And here this is the anterior mediastinum in the gray color. Anterior mediastinum here, and it is also the anterior mediastinum here, and the middle mediastinum in the green color, and the posterior mediastinum in the blue color. Here, this is the anterior mediastinum in the red, and anterior mediastinum in the red, and the middle mediastinum in the green color, and the posterior mediastinum in the blue color. The green color, it is middle mediastinum, and this is the viscera of the mediastinum. Thank you for listening. Hoping to see you soon in another talk.